If you guys have been following our YouTube channel, we have already discussed the need for GTT. Many questions have been asked, why do I need a GTT? Yes, it has been offered as a universal testing to find out the women who struggle with gestational diabetes. But if you're unable to tolerate the GTT, please speak to your own healthcare professional to discuss alternate options for diagnosis of diabetes. Now, with gestational diabetes, I think we mentioned in our previous video as to why it is important for us to control the blood sugar. So many questions have been asked, how? Let's go back to the basics again. So eating a healthy diet. So how do you manage that? So make sure you have low GI carbohydrates, high proteins, low in saturated fats. These are your general guidance principles. I'll touch on the specifics in a minute. And daily exercise. Exercise depending on your tolerance levels. So with the exercise, if you have been exercising prior to pregnancy, then you will be able to tolerate or have higher stamina to go through a moderate to high intensity exercise. But if you're only starting now, keep the exercise simple but consistent. So let's just go back to our diet. I'll give you some basic guidance, but it would be better if you do seek help from a dietitian or a diabetic educator to calculate the calories and the carbohydrate portion size that is suitable for your own specific needs. What I'm giving here is just a general guidance of alternate options that you can seek. I do understand that there can be lots of dietary restrictions for many women or vegetarians, so choose your carbohydrates and proteins accordingly. So try and space your carbohydrates throughout the 3 meals that you're having and the small snacks. Like mentioned before, make sure they are low GI compounds that will help with the slow release of blood sugar into your stream so that there is no sudden rise and fall of blood sugar. An even release would help maintain blood sugar levels that are optimal both for yourself as well as baby. So what are the general carbohydrate foods? So the general carbohydrate foods, as you all know, bread, rice, pasta. So all those are the general carbohydrates that are in our day-to-day diet. What can we do, or what are the better quality carbohydrates that can be used to substitute the regular pattern of eating? I'm going to read out a list of substitutes that has been advised by Diabetes Australia. First things first, bread. So you can choose the dense whole grain, multi-grain or bread with seeds. They are lower in GI. If you are a rice eater, switch to basmati rice or brown rice. You can stick to, if you are a pasta eater, then you can go to, again, the pulse pasta or the pasta that's made at home and cooked al dente rather than cooking or overcooking pasta. If you are a noodles eater, again, brown noodles or noodles made with brown rice or soba noodles are also helpful. Definitely these are smaller portions, and make sure that it's only just 1/4 of your plate, and fill the other half of the plate with your protein and vegetables. In terms of the fruit intake, again, smaller quantity at one go. Reducing the overall carbohydrate content of the meal is what's really important. But then there are people who come back and say, look, I've been eating healthy, nothing's changing, and I'm always hungry. Now, that's where protein helps. So if you are a meat eater, very easy, grilled or steamed meats are your best options that will help you keep full as well as reduce your blood sugar levels. For vegetarians or vegans, you can have pulses like your chickpeas, your rajma, red kidney beans, or Mexican beans. They're all high in protein as well, but bear in mind they do have some carbohydrate component, so you just need to adjust the serves and make sure that the overall carbohydrate is still with what you can achieve normal or near normal blood glucose levels. Also, performing some walking or some gentle exercises post-meal will also help keep your blood sugar under control. Remember, pregnancy is a gluconeogenic state, so the placenta will produce hormones that increases the blood glucose levels. So you may try your best and it can lead to despair because that's what your body does. But if that is a situation, then in Western Australia at the moment, the insulin is the only medication that is available to be used during gestational diabetes management. But as much as we can, if we can manage your gestational diabetes with diet and exercise, you will have a near normal pregnancy and good outcomes as well. So good luck with this journey. And if you'd like to see us during this journey or seek help, then you can definitely visit athenawomensclinic.com.au to book an appointment and see myself or our midwife. But otherwise, please seek advice from your own healthcare professional or the hospital that you're booked into to give birth.